All right, so talking about the different types of anemia, lectures will not be complete if we don't talk about the Diamond-Blackfan anemia, okay? So you guys will be surprised, like, okay, is there something like Diamond-Blackfan? Yeah, there is. There's something like Diamond-Blackfan. Do you understand? Diamond-Blackfan anemia is a rare type of anemia. So discussing, you could call it Diamond-Blackfan anemia, you could call it Blackfan diamond anemia, okay? Switching the names doesn't really change anything. So under Diamond-Blackfan anemia, we'll be having a definition. We'll be talking about symptoms. We'll be talking about the genetic disorder. We'll be talking about the red cell production. We'll be talking about the rare condition. We'll be talking about the treatment. We'll be talking about the complications. If you leave Diamond-Blackfan anemia, what we actually grow up to become or lead to. They'll be talking about the prognosis. Okay, so we have several headings to actually help us properly define this rare condition of anemia. So looking at the Diamond-Blackfan anemia, all anemia are just characterized by low blood cells, okay? And the problem is from the bone marrow. So looking at the Diamond-Blackfan anemia, that Diamond-Blackfan anemia is a rare genetic disorder that affects the bone marrow and disrupt red blood cell production. Okay, so here are some key points you should note about Diamond-Blackfan anemia. First of all, you should look at the symptoms. Symptoms usually start appearing early in life and may include what? Anemia, of course. The patient will have a pale skin. They'll have trouble sleeping, that sleeplessness. Okay, sorry. They'll be like, okay, they'll have urges to sleep. Okay, that's sleepiness, not sleeplessness. All right, they'll have frequent urges to sleep. They'll have fatigue. They'll be weak. They'll be fast heartbeats. Okay, so talking about this genetic disorder, we see that Diamond-Blackfan anemia is a genetic disorder that happens when certain genes mutate or change. Okay, so when they say certain genes, that means it is not really clear which gene actually causes this. Do you understand? It's still a disease in um in study. All right. So red blood cell production. We say that Diamond-Blackfan affects people's bone marrow and disrupt red blood cell production. So people rely on blood cells to carry oxygen throughout their bones. Do you understand? Or bodies, sorry, throughout their bodies. So if it's disrupting red blood cell production, then you know that definitely there will be a problem in the transport of oxygen in that individual. So it is a rare condition. So each year, only about 4 children in 1 million children in the United States are born with what? Diamond-Blackfan anemia. So it is rare. Okay. So what is a possible treatment for Diamond-Blackfan? Um, allo Allogenic stem cell transplantations are the only known cure for Diamond-Blackfan anemia. Okay, because it is affecting the stem cells. So if you can do a transplant of stem cells, then you are basically good to go. All right. So we said that in allogenic stem cell transplantation, healthcare providers replace abnormal stem cells with healthy stem cells. Okay, and this is actually to boost the production of red blood cells in the body. Okay. So looking at the complications, we said that Diamond-Blackfan increases the chance people may develop life-threatening medical conditions. Now, people with Diamond-Blackfan anemia have an increased risk of developing myelodysplastic syndrome, okay, and also acute myeloid leukemia. That's a type of bone cancer called what? Osteosarcoma and other cancers, okay? So what is the prognosis, okay? What is like the overall, like people who have Diamond-Blackfan anemia, what is their fate? Okay, uh, Diamond-Blackfan affects people in many different ways, making it difficult for healthcare providers to offer a prognosis. Okay, so some people who have this condition may have medical conditions with mild symptoms that don't affect their lifespan. Other people may have severe symptoms or serious conditions such as what? A severe anemia, a heart or kidney tissues, um, heart or kidney issues, okay, that may be life threatening. All right. So it's basically hard to actually put out a prognosis on Diamond-Blackfan anemia because some people had this condition and it's not really threatening them, why some people have this condition and it's like they are going to die tomorrow. Okay, so guys, that's it about Diamond-Blackfan. You could see these are the various symptoms of anemia. Okay, so it should have these general symptoms of anemia. Okay, all right, and some other few symptoms that are what peculiar to it. All right, basically the symptoms, like, okay, it's basically the same thing. Do you understand? Have anemia, pale skin, sleepiness, fatigue. Of course, when you are weak, you'll be feeling like to sleep. Do you understand? The fast heartbeat, that's basically palpitations. All right, you guys asked it about Diamond-Blackfan anemia or Blackfan diamond anemia. Okay, this is talking about symptoms, causes. Causes is basically genetic disorder, symptoms, and treatment. Okay, that's it, and see you guys in the next area. Bye for now.